Good morning, everybody. Welcome to UOWD On Air, a podcast series looking at contemporary topics. And one very important recent topic, of course, is the storms that we had last week in the UAE. So we're doing a series relating to that topic. Today, actually, we'll be looking at some of the health challenges associated with the storms. Also looking at community building, resilience, mental well-being. So it's an exciting start to the series that will also be looking at probably at, I guess, financial aspects of the impact, the financial impact that the storms have had. And also probably some of the engineering experts will be speaking to that topic soon. I'm very excited to have with me a cherished colleague from the School of Humanities, Social Sciences and Health, Dr. Susanne Robertson-Malt, or Dr. Susie as she's affectionately called. Welcome, Dr. Susie.
Thank you, Feras.
Susie, we've had conversations actually about public health in general, you and I, and the school. And I think one of the things that we were talking about at the time of the COVID pandemic is just the era in which we lived. And I remember you telling me that there are eras in human history that are challenged in different ways. So there was an era in which, bacterial infections, bacteria was the biggest threat. And then we discovered antibiotics, but then we have viruses. And then we have super bacteria that require super antibiotics. I'm not even sure if I'm using the right terminology,
you are.
But in which era do we live in terms of pandemics now, before we get to the flood and natural disasters?
So we're very much, with the COVID pandemic, it very much taught us that we're still very firmly in the virus.
Mm-hmm.
But the virus, we are still trying to understand. So as you pointed out, we've had centuries to understand bacteria and develop all these amazing medications, which we've overused and abused, and as a consequence, super. And now we've got this whole program of antibiotic stewardship programs because of the fact that we tend to use them inappropriately.
Right.
And so we're now in the viral era. But with our advances of proteomics and genomics, we're certainly learning how to use the virus as a vector to actually deliver medications for us.
Okay.
So whilst it can be seen as a significant threat, if we step back and take time to really study and learn it, which the world is doing, it can become a friend to us.
Okay.
Which is
and in that sense, vector then is a positive as well as a negative.
Yeah.
I mean, it has both connotations.
Unfortunately, the mosquito.
Yeah, is a vector for transmitting malaria and so on. So in this
hepatitis
in this sense, now just moving into the actual recent storm and the floods and the ensuing kind of water accumulation, would you say that that's, I mean, apart from the infrastructural damage and the kind of the obstruction to normal life that happens.
Yeah.
Are we looking also at the potential for certain vectors for disease to be there?
So it's so many factors influence that, as you can appreciate for us. We have the temperature.
Yeah.
So if this flood had occurred during winter, mosquitoes aren't very much around. They don't like the cold.
Right.
So as we're moving more into the warmth, but we're not in the full-on heat of the UAE, which the mosquitoes also don't like, we're actually in that in-between phase where the actual mosquito can take advantage, or not that they do it deliberately, but they actually...
It's just what they do.
It's just what they do. They actually just drink. And unfortunately, then they eat, and
Us.
If that water is contaminated because of the actual sewage or wastage of any capacity, that can actually become a vector for us for things like typhoid and cholera.
I know that recently the the Ministry for the Health and Prevention, actually about a month or so ago, before the storms, actually was kind of had the foresight to be looking at a national center for the prevention of epidemics.
Yeah.
What do you think are the challenges there, and how much have you had kind of contact?
Well, that's a really good use of the word challenge, because COVID actually taught us that this isn't going to be the last.
Yeah.
And that given the population of the world, given our ability to move so easily around the world, these communal diseases and viruses are going to continue. And so countries all over the world are actually having to pay attention to their national strategy for epidemics. So, as you said, the UAE, being who they are, they've always been forward-thinking, and always keeping up with the science and what we need to be thinking about with the sustainability goals, that we basically must be ready. We can't react. We have to be proactive for these events.
It's really amazing, actually, that if you think about it, we can't deal with these things in separate ways. We can't deal with the potential for the impact of climate change, and this I think this is a very good example where the natural world reminds us of the possibility of double or compounded threats.
Enough's enough.
Yeah. It's really it's a kind of reality check.
Yeah.
I guess, I mean, the challenge, of course, with urbanization, as you know, I mean, the UAE's, has gone to achieved major strides, I think, in facilitating a kind of the quality of urban life that we're used to here in Dubai. It's a phenomenal city. And I think the attention that Dubai got in the storm is also a sign of the envy felt by the rest of the world that this wonderful city has had a challenge. And I think Dubai has responded, and the government certainly has responded in amazing ways, because we're back to normal, barely a week later.
Yes.
But how much is actually the whole threat of public health tied to urban centers? It's because of this where human populations are their most concentrated, surely, right?
Yes, yeah.
And that's a growing growing global phenomenon, I think.
That's right.
That the more our cities become congested, the more
Dense.
condensed, because people, of course, migrate there for employment, for their livelihood, and so I think we are. I hear you when you say this is just the beginning of the kinds of challenges we'll be facing as societies in the future.
So you're absolutely right, Feras, that it was with the advent of the industrialization, moving away from the agriculture communities where you had large land spaces between small populations, bacteria, rats, vermin. Congregate.
Yeah, that's what the stuff of the history always in those medieval histories.
And so cholera, there's a famous public health case where you had the breakout, the epidemic of cholera in London. And it was actually through a careful analysis of the water wells where people were collecting their water and then honing it down to the population around that water well that actually was contracting cholera, that the whole public health movement emerged. Yeah, that we really need to be studying the interrelationship between the population and the environment that we live in. And if we don't pay attention to that, then we're actually at risk. So, issues like cholera, typhoid, things that we believe were existed in the plague, that was the plague type of thing. They're of the past, but they're there and they continue to be there in underdeveloped countries where they don't have the infrastructure, as you pointed out. If the government isn't paying enough attention, enough money to ensure sewage is well managed, water, clean water, potable water is well protected from other forms of water and groundwater and contamination, then you are at risk if you don't pay attention to that. And so vaccines evolved to actually treat those. And so in countries where they don't have that ability to rely on that infrastructure, typhoid and cholera vaccines are required. In countries where you're evolved, they're not, because they're only considered to be needed if you're at high risk.
Right.
So, because vaccines cost and, they're not part of your standard, measles, rubella.
Packaging that
packaging
you get when
you get as a kid.
As a child,
Yeah.
I think, also the storms moving away a little bit from the issue of the public health response, but also a bit to the kind of perhaps the emotional response to the floods. I'm curious if you've had any thoughts about the challenges to general mental well-being. I mean, I know that the COVID era began, kind of unleashed a set of mental health concerns and mental well-being. And I know that you and I were thinking about projects actually to investigate, particularly as it impacts kind of, young communities, adolescents and so on. Do you think that this recent event has perhaps reminded us of the need to stay on top of the mental well-being agenda?
Absolutely. And COVID certainly increased our appreciation of the need to develop skills and resilience. Resilience being, as we know, the ability to adapt to change. I think you and I often talk about the younger generation and when they look towards the future and all they see are these catastrophes, like the pandemic, and then all of a sudden extreme weather conditions. You think, how do they, they get angry at the adults? Why didn't you look after us? Type of thing, that whole.
Interesting.
And then, so helping them to develop skills to be able, not just them, but everybody, to be able to recognize, to adapt, but more importantly, and to appreciate that this too will change, and community. Community is the most important thing.
I want to speak about community actually, but in a minute, because I want to just focus on the issue of resilience. I think it's a very interesting question, and you're right. This generation, Gen Z, or Gen Alpha, as they're emerging now, I think they are probably challenged in the way that the generations between the wars were challenged. I mean, they emerged from one world war to another one.
Yeah.
So the kind of, I guess, emotional and mental traumas are probably very real. I'm wondering whether you think for you, that's not just something that actually challenges the younger generations, but all of us, only because of the nature or the levels of expectations that we become accustomed to. When you live in a city as wonderful as Dubai, as where the standard of life is, it's so, so privileged in that sense. But we're always reminded of the precarious nature, I think, of modern living.
So important.
Because we're so dependent. I mean, I'm always thinking, if I had a garden, would I know how to grow some tomatoes and cucumbers? And I think
for food supply.
One of my colleagues grows aubergines, and that's exotic. But I don't know if I could manage. But I mean, basic things.
But I was at the Spinneys the other day, and I was quite annoyed that I didn't have limes, and I didn't have my normal bread.
Very peculiar.
Do you know what I mean? And so I said to the grocer gentleman, and I said, "Where are the limes?" And he just said, "Well, the planes couldn't bring the supply."
Sorry, Susie, but your very specific limes will have to wait.
That's right.
Yeah.
So, but you pointed out that we fail to appreciate how convenient our living has become.
Yeah.
And so if we develop skills to appreciate the fragility of that and the impermanence of that. Another example is that I live on the 17th floor in a building in beautiful Business Bay. All the elevator shafts were full of water.
Right.
So for 4 days, we didn't. And so you get quite annoyed that you can't just push
a button and get immediate response.
Yeah.
Back to your daily routine.
Yeah. So I think that's such a... And so resilience helps us manage our anxiety.
Right. Here we go. This is what I wanted to get to, really.
So our levels of anxiety can increase just by turning on the news. You know, when do you get good news in the world today? So just by turning on the news, you can feel your, adrenaline just increase, your cortisol just start increasing. And so we almost live in a normal state of heightened anxiety.
Is there by the way, I'm just going to go off topic here because I think it's very important. Is this an analog to the idea that the current generation of kids constantly on their video streaming and their TikToks and so on, just the amount of emotional pressure being put on them because of these heightened levels has a significant impact. I mean, not just in learning.
Totally. So, if you exist in a social community that's online and that social community is connected to a particular theme about society, which it typically is, because that's what gravitates you towards these communities, then that's all you're hearing all the time. You're not actually hearing something different. So you're in this loop that's actually limiting your ability to see the bigger picture. And so that's a really important thing. And we've seen so many examples of that with the gun violence. And
I guess it's a kind of diet. It's the way that you
it
exist.
is.
Just like you're on a diet of high salt, you're going to have
Totally.
high blood pressure all the time. You're a diet of this kind of anxiety, ingestion.
Yeah. And if your world is determined by this, liked, not liked.
Absolutely, yeah.
I've got 100,000, or 2,000 likes. Today I've only got, 1,500. I'm not liked anymore. It's like, we don't want to trivialize it, but if that's what you've been conditioned to, then it's a constant source of anxiety.
Susie, when you spoke about mental health and resilience, I mean, especially in the context of the recent storms, I'm thinking, is that you must mean something beyond the clinical. I mean, the clinical industry that attends to mental well-being is one thing.
Yeah.
But what are some of the other means in which people can solidify their kind of, or just, help each other strengthen that?
So the most important thing I believe is that, and the evidence is increasingly showing this, that we have to take care of the local. And you pointed out a perfect example for us about, growing vegetables in your garden. Because when you are in circumstances where all of a sudden you don't have access to that food, the fact that you could go into your backyard or you could go to your neighbor or your community and help each other, incredibly important. But if you exist in a building or you exist in a gated community where you actually don't even know your neighbor or you haven't actually spent a lot of time to get to know your neighbor, then you're isolated. Another form of anxiety.
And that, of course, that augments one's anxiety.
That's right.
But by contrast, if you knew that your neighbor was empathic in that way and sympathetic to your plight and probably in the same boat as you, then that helps.
You look after each other. That's the most important thing. It's just that and so to your point, yes, we can have community health centers and we can have hospitals, but they're when something has happened, to manage an illness of some capacity.
Yeah.
We as individuals, families and communities can continuously support ourselves through building relationships.
Okay.
Building and developing ways to communicate and support each other. So you don't feel isolated. But if you think about, as you said, our normal behaviors, we're also focused here. And if we're not focused here, we feel as if we're actually connected. And then if that is what we're doing and our family, then we are actually isolated. So taking time to do things that take you outside of your usual space, very enriching, very important.
Susie, it seems like there's a kind of multi-pronged approach to actually tackling such global challenges such as mental well-being. You mentioned, of course, we all know about the clinical industry, and that's why I kind of wanted to put that on one side. But you talked about community, which is something that everybody can do. But what's the role of academia in that? I mean, how do you understand? You yourself teach a course on a topic on emotional intelligence.
Yes.
And how much do you expect to impart to your students, and what are you thinking are the kind of the outcomes of those modules?
Well, you and I have often had a conversation about how fortunate I felt that when we established the health science program, that it was actually in the School of Humanities. Because to me, I believe it's a human skill that we develop. And so I feel we often have those conversations about how fortunate we are. I believe that if we can give foundational programs to students on how they do develop their resilience, and increasingly all over the world, the Centre for Healthy Minds, for example, one of the leading institutes in the world that actually has developed some of the most influential science around the management and development of education programs to manage resilience and develop compassion, basically, for our fellow human beings, and we're all in the same circumstance. These programs have had profound impact on young people's ability to manage and cope. And so the more we can actually introduce such programs of mental well-being and health, moving mental well-being away from mental illness, recognizing that mental well-being is as important as physical exercise, and that it doesn't come naturally, not in the world we exist in. We actually have to be
make an effort,
developing skills at within schools, within universities,
different levels of segments of society.
That actually, like in humanities, you have those programs that give students those foundational appreciations of history, language, health, and mental well-being is one of those essential pillars.
And I think it speaks to your point earlier that I think, however, marvelous and fantastic the response was by the UAE government, which has the resources to be able to get everything back on its feet. I think as a society, there's, I think, a responsibility at the community level to have a supporting and complementary actually role in forging the kind of ties, because I think it's very easy, like you said at the beginning, in a modern city, to just move into your flat, not know your neighbors, not know the community. In fact, I'm reminded when on the day of the floods, we were lucky. I mean, we were the ones that just had some water kind of seep into the house. But I was throwing out buckets of water from the balcony. And I remember looking around, see if anybody else was throwing out buckets of water from the balcony.
Yeah.
I did spot one gentleman. I waved him in. So it was a moment of kind of,
connection, recognition, and we're in it together.
Reassurance. At least. Right. I'm not the only house in the neighborhood that's suffering. So I think your point is a valid one, and I think it's a very important one for emerging communities. I mean, societies that are still kind of forging that kind of fabric. Dubai has so many different nationalities, so many different incoming. It's a fast-paced society.
And I think, to your point, Feras, I've been so impressed with the urban design, eco spaces, livable communities. The government certainly recognises that importance. You just go to somewhere like City Walk or any of these places around, they're really paying attention to how we unite living and working in a communal space. And so the government can do one thing. That's up there.
Yeah.
So that's like the Minister for Happiness or the Minister for Health and Community Wellbeing. They can set the strategic plan. They can build the bike tracks. They can create all these amazing facilities. But we have to do something too, So that's the as you say, like what can higher education institutions do? We can develop the knowledge and appreciation that it is your responsibility. Don't leave it for somebody else to take care of you.
Absolutely.
It's your responsibility as well.
Yeah. The well-being and the health of the city.
Yeah.
As a city, emotionally, socially, culturally, is dependent on the involvement, the contribution
individual.
of every individual. Absolutely.
Yeah.
And I think that's easily overlooked in the kind of, given the pace of life, given the nature of how cities are and how condensed they are. But I think it was very clear. I mean, locally in our community, I think it was clear that people were coming out every day, volunteers just pulling cars out of the water because I think there's not enough tow trucks.
Yeah.
And things of that nature. So
and you see, and that's another beautiful reflection of the community here, the amount of announcements about housing being provided, temporary housing being provided, and large corporations saying that, we will pay for all the maintenance and we will help and we'll supply food. And so there is that sense of coming together and recognizing that, we need to look after each other.
Susie, is there anything else you want to add? Personal reflections on this? I know you are somebody who thinks of health sciences in general.
Yeah.
You're also kind of a senior nurse for me.
Yeah.
You're naturally given to look after other human beings.
Yeah.
You also have an interest in Dubai itself. You're an academic here. You have your life here. So, any final personal reflection on post storm day?
Personally, one of the most important skills that I have learnt to develop well-being is the act of regular contemplation, moments of deep reflection, whether that happens in the form of prayer. And I think that's what's so amazing about the community that we live in, that the community takes a minimum of 5 times a day to disconnect. That's incredibly important. That is actually a really, I believe, and we need to study it more, an important mental health action.
It's like it's a kind of an important psychological posture that you have, that you do that. And I'm reminded at the height of the kind of almost typhoon-like winds that came in the afternoon, about between 3 and 4.
It was like an eclipse.
Yeah, it was that, and yet the call to prayer.
Yes,
I could hear it amidst the chaos. So it was a very nice reminder, I think, of what you were just saying. So.
Yeah. So again, the evidence is out. It's confirmed. We don't need to question it anymore. That if you develop a regular practice of contemplation in whatever form it is, non-secular, it actually supports you. It supports your well-being and your mental health.
On that lovely note, thank you, Dr. Susie, for being with us today.
Thank you for being a wonderful interviewer. It's wonderful.